Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and we are live, and with me Vinod is here, and we did live for Vinod on 4th of November 2020 before the therapy. Now we are live after the therapy, and you can listen his pre and post voice. So Vinod, tell about your problem, and after the phone calls, when you are calling to your friends and family members, what is the reaction after treatment?
Hello, doctor. So after I speak to my friends and family, they were basically not able to recognize me instant initially. They were asking so many questions whether did you get prana or using any voice or something. So many questions actually. So basically, not able to recognize.
I think something network issues
So
happening.
it was
Yeah, continue.
yes. So it
So
was
what
like
was exactly the
completely. I
problem
mean,
before
like.
treatment? Can you describe, and when you spoke to the friends, what they are telling?
So yeah, they were telling like that's what the main thing was. They were telling they get corona. They asked first because I'm away from India, so they were like thinking they were more in fact.
I think
So
sometimes
yeah,
network is issues happening.
and
Sometimes your voice is not coming. Can you little more closer to the this camera? Sometimes your voice is not coming.
now is that fine, doctor?
Yeah, come little this side slightly. Sitting position slightly this side. You can come. Yeah, that is better.
So
Yeah,
is
now
that
you can tell.
okay? Yeah, okay. Yeah. So that's what I mean. No one is able to identify. So even in
Okay,
my
so to just to
calls also.
continue, yeah, continue this conversation. I want you to tell any story so that at least people can hear the voice also, and we'll keep talking.
Yeah, okay, sure. Okay, I will tell the crow story.
Okay, fine.
Yeah. Once upon a time, there was a thirsty crow searching for water in a hot summer. The crow came across so many villages, so many places, but the crow couldn't find even a single drop of water anywhere. After a long struggle, the crow found some small pot of water. The crow went near to the pot and put his mouth and tried to drink the water. But unfortunately, the water level was very less. The crow couldn't water. The crow started thinking and tried to push the pot so that the water will come. But again, unfortunately, the crow couldn't push the pot because it was very strong. And crow again started thinking. The crow could have gone some other places for searching water, but the crow didn't do that. The crow again started thinking, and it was looking around carefully. There were some stones nearby. So the crow took the stone, put inside the pot, and again the crow took another pebble or stone and put inside the pot. At one point, the crow noticed the water level started increasing. The crow was very much happy. So once the water level reaches high, the crow drank the water and flew away happily. Yeah, doctor.
Okay, I think sometime network issues. I'm sorry, voice was sometime not coming. But anyway, people can make out the change. And we did live for Vinod on 4th November 2020. So I will suggest those who are watching this live, they can also refer the 4th November live. And I will introduce myself. My name is Sanjay Kumar. By profession, I am a speech language pathologist and audiologist. And I have done my graduation from AIIMS Delhi in the field of speech and hearing sciences. And AIIMS Delhi means All Indian Institute of Medical Science, New Delhi. And I have done my post graduation in the field of speech language pathology from University of Mysore. And my area of interest is treating voice disorder. And Vinod was having a feminine voice, and due to the COVID and all the traveling situations, he can't come to Bangalore. So we decided to give online therapy, and we have given the online therapy. And now you can see his voice, how is today, and you can also check how was on the 4th November. So you can check our 4th November live. So Vinod, tell your problem and how do you feel because some new people have joined. What is the reaction of friends and
Yeah, so
family members? There are some many people. So already you have spoken, but you can repeat. I don't mind.
yeah, okay, okay. So yeah, I think I have to make friends and office colleagues and family. So first thing, my family, they were more scared because
So they were
of
able to
this
recognize your
thing
voice or
rapidly
not
in
when
India.
you spoke to your
Yeah, yeah,
friends. They were able to
yeah, I did
recognize
that.
in the first time without the video call.
I mean, they without video call, yeah, no. I mean, they instantly they were like shocked. What happened? So instantly they asked, "What happened to your voice?"
Mm-hmm.
Then I started. I mean, I told them what would have been this, and then they say, some people told you might be using voice app.
Mm-hmm.
Some people told, "Did you drunk?"
Mm-hmm.
Some people told, "Yeah, there were so funny things came
Mm-hmm.
actually."
So
So,
interesting experiences after that because sometimes
yeah,
now the COVID things are going on. So when the voice changes, so once it look like a different, so they will react. Have you developed something, some issue, health issue? Sometimes people will not recognize. Sometimes people will ask, have you developed some problem? So it happens. But overall, once you record your voice sample and you compare, you will find the difference. So once you just played your pre-therapy recorded sample and the post-therapy, what difference you found it?
I mean, yeah, I found a huge difference actually. Like,
Mm-hmm.
if I compare my video, yeah, definitely
Mm-hmm.
a huge difference. It's a complete change of
Mm-hmm.
tone and everything.
Okay.
So I'm happy now. Yeah.
Okay. And someone was asking about the pronunciation, stammering problem and all. So yes, we also provide speech therapy for the stammering. Those people are having the stammering, and in the stammering after therapy, we have seen changes among 80% of the population, but there is no 100% cure of the stammering. So of course, you can call us at our contact number is 080-420-41980 if you are from India. If you are from outside India, you can call us 9180-420-41980. And our details you can find to our website at www.speechtherapyindia.in. So you can click reach me and you will find all the details. So I was getting some questions and about the stammering. So of course I have given the answer. And yes, so tell about your education and the work. I think we need to talk. So I will just prolong
Yeah.
this conversation. So it will be a kind of yes, how you are facing the world will come to know also because we
Yeah.
are live. So you know that so many people are watching. So it will be give you a confidence to you also.
Yeah. Okay, doctor. Sure.
Mhm.
So I live from Chennai. So I born in Chennai
Mhm.
and reading in Chennai, and I'm coming for in Chennai. Now currently I'm in UK.
Mhm.
So most probably 1 year I'll be working here, and next year I'll be like going back to Chennai.
Okay, so what work you do? What is your
I work
profession?
for IT software.
Mhm.
Uh, yeah.
So what is your job responsibility in IT field?
So it's like software development. I'm into software development.
Okay.
Yeah.
Okay.
So
Okay. And what are your hobbies? How you spend your time on Sunday?
yeah, mostly I watch videos. I mean, Netflix, Amazon, and some movies, newly released movies. I used to watch. I used to spend time, and sometimes I used to roam with my friends. So here we used to go and visit some places nearby park. We used to go, and sometimes we for jogging.
So, which
So,
movie you have seen recently?
I mean, yesterday we saw Surarai Potru movie. It was a Tamil movie released yesterday in Amazon Prime. So I saw that movie. Yeah.
Okay. And so, where you studied, where you did your graduation, in which college?
I did my graduation in DMA College of Engineering. It's in Chennai.
So, when you left Chennai and when you went out?
I mean, so in my company, I mean, in 2015, I think 2015 I moved, sorry, 2016, I think, yeah. 16, I gone to Qatar initially for some project work. And then now I came to London in 2018. It's been 2 years.
Okay, so those who are watching this live, they will be asking two kind of questions, and I will try to give that answer. One thing they will be asking, they will tell XYZ communication problem, and the question will be how long it will take to treat. So what we do first, we try to do the perceptual evaluation, means we try to listen the patient's voice, and once we understand the problem, accordingly we suggest the duration of treatment and cost of the treatment. And sometime if needed, we ask the patient to go for the test we call laryngoscopy to the laryngologist or otolaryngologist, but not for all communication disorder. So if anyone is having any communication problem, voice problem, speech problem, and if they want the help from us, they should call to us 080-420-41980 if they are from India, and if they are from outside India, they can call us at 9180-420-41980. We'll do the perceptual evaluation, and then if needed, we may suggest some tests. And the common test which we suggest in some communication disorder, not in all, is the laryngoscopy, and that will test will be done by the laryngologist or otolaryngologist. So don't get confused, not for all the patients. So first we want to listen the voice, then only we suggest the test. And our details you can find at our website www.speechtherapyindia.in. And those who have joined newly, for them information is, my name is Sanjay Kumar. By profession I am a speech language pathologist and audiologist, and I have studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi. I have done the graduation in the speech and hearing science from there, and I have done my post graduation in the speech language pathology field from the University of Mysore. And my area of interest is treating voice disorder. And with me, Vinod is here. For Vinod, we did live on 4th November 2020, and today on 14th November 2020, again we are live after the treatment. So Vinod is here and he's telling his experience. So some people has joined newly. So Vinod, can you repeat the same thing maybe? What exactly the problem was, and when you are calling to the friends, family members, what is the reaction?
Yeah, I mean, yeah, they were like, initially they were like
First, you
confused.
tell what was the problem, because some people don't know what exactly problem. So don't use the technical word. Just simple way you try to explain what was the challenge, why you contacted me.
Okay. So initially, like because of my voice, I couldn't raise my voice in public, and basically it was a high pitched voice, so I couldn't talk in public. My voice was very low, and there were so many vibrations in my voice, so I couldn't speak properly initially. And now after the treatment, I think I feel like now I got a nice, decent low pitch voice. And yeah, so I think after I called to my friends, they were like totally confused. I mean, yeah, especially during this Corona time, they were like saying, "Did you get Corona?" And moreover, I'm away from home, so my friends, family, in fact, everyone got confused. What happened to your voice? What happened to your voice? And, I think some comments I got like this is better. I mean, this voice. Yeah.
So even you have heard your recorded sample yesterday. So first time when you compared your first day voice sample on the 4th of November, what we took, and yesterday also you just compared. So what difference you found it?
Yeah, I mean, it's completely different. I would say it's. I noticed like I mean now I'm speaking like a proper the words everything like I'm pronouncing properly. I think yeah.
Yeah.
So I felt very huge difference.
Yeah, and this problem consists of two parts. One is the vocal cord doesn't vibrate effectively, and other is the psychological part. So with the time, I have seen the patient get more confidence, and I'll be getting some questions from my patient about the relapse of the problem. So for that, I have given the answer. Even in fact, on the 15th August, I was live with my 4 or 5 years old patients. So sometime I do the follow up, and I have found very good feedback from my most of the old patients. Okay, and sometime I will try to become live with you also in the future, maybe after 2 3 months, if you'll be comfortable and you'll be free, because this will be the most patient having the fear. So you just explore. I'll be suggesting those people who are watching. At least the 15th August 2020, I did live, eh, and I try to give the answer about the relapse happens or not about the this kind of problem. There is just sometimes relapse happen. I have seen in the problem like a stammering or a stuttering after the speech therapy. But in the Puberphonia and the vocal cord paralysis, if therapy helps to the patient, I have seen that the voice will be stable. What I have learned from my patient, from their feedback, in most cases, I can say the 99% cases. 1% I'm just keeping for the safety. We are not a god, not a Superman. So it will be stable. I can say even the more than 99%, I can say that. Okay, and why this problem occurs, high pitch voice or feminine voice? I will be uh, just try to explain a little bit. During puberty, mass of the vocal cord, length of the vocal cord changes. So, because of the hormone testosterone, before puberty, the vocal cord behave like a thin string of the guitar. But after puberty, vocal cord behave like a thick string of the guitar. Because of the testosterone hormone, the vocal cord mass length increases. So when the guitar string is thin, the pitch will be higher. Vocal cord will produce the high pitch voice, same way how the guitar string produce the high pitch voice. But when the with the effect of the testosterone, when the vocal cord mass increases, length increases, so it becomes thick. So the vocal cord will behave like a thick string of the guitar. So means the pitch will be low. So what happened in most of the cases, the children will speak in high pitch voice from childhood to till puberty. And during puberty, mass will increase, length will increase due to the hormone called testosterone. So uh, the voice should be low pitch, but because of the so many years habit, they will not accept the new voice. They will maintain their childish voice and high pitch voice. So their whole mass and whole length will not vibrate effectively. So suppose if this is the vocal cord, so they will be vibrating only thin edges of the vocal cord. So if they will vibrate only thin edges of the vocal cord, so vibrating mass will less, vibrating length will less. So if vibrating mass is less, vibrating length is less, the vocal cord is behaving like a thin string of the guitar. And when the guitar string will be thin, the voice will be high pitch voice. So what I will be doing as a voice therapist, many people will be thinking what I do. So I will try to stimulate whole mass and the whole length. Suppose it was vibrating only thin edges in cases like yours. So I will stimulate whole mass and the whole length. So once you stimulated the whole mass and the whole length, so it means what? Vibrating mass will increase, vibrating length will increase. So vocal cord will start like behaving like a thick string of the guitar. Now what exactly it is? So if guitar string is thick, then the pitch will be low. So this happen in the most cases of the puberphonia. But sometimes high pitch voice can be also seen in the case of sulcus vocalis. High pitch voice can be seen in the muscle tension dysphonia. High pitch voice can be seen in the phonatory gap. High pitch voice can be seen in the sometime in the spasmodic dysphonia also. So the proper evaluation is very important by the professionals. So I have seen sometime the healthcare quacks will try to give therapy, try to make the videos and the put on the YouTube. So I'll be suggesting if you will take the help from the healthcare quacks, there may be a chances sometime you may damage your vocal cords, because Wrong vocal exercise is equivalent to a vocal abuse. Vocal abuse may result into the vocal nodule or some voice problem like a muscle tension, dysphonia, and phonatory gap. So those who are watching this YouTube live, I'll be suggesting always take the help of the professionals. And how you know that? Who are the professionals? So try to find the if any speech therapy center is there or any person who's claiming he's a speech therapist, from where he has studied, which college he has studied, which year he got the degree in speech language pathology or speech and hearing science, if he has registered in the Rehabilitation Council of India or not. And if you have doubt, you can ask the RCI number, Rehabilitation Council of India registration number. So if they will not give satisfactory answer, then only you may think that he may be the healthcare quacks. So because of unemployment, many people try to study something on the net, and they will make a video for awareness, and then next day they will start telling that they are a speech therapist. So for become a speech therapist, we have to study very good speech therapist. If you want to become 4-year bachelor, 2-year masters, so 6 years. So not watching the 6-minute video, anybody can become the speech therapist. And watching YouTube, they will sometime patient will experiment on themselves also. And after experimenting, they will come with the vocal nodule and the phonatory gap to my clinic. I have seen many cases. So always take help from the professionals. That is my suggestion. So I think there are many people have joined Vinod now. I can see that after this. So can you tell your problem again? Because there will be some new people will be joining. And how do you feel and what are the reactions you are getting from the people?
Yeah, I mean, now I think I feel better actually.
Mm-hmm.
So earlier I was like having a low, very high pitch voice, and it was not stable also. Sometimes I used to get dual voice, something will be there. But now I think after treatment, now I feel like now the voice is stable, and whenever I speak to my friends.
So what was exactly the problem? First you tell your problem and then you tell you are feeling better. So what better you are feeling, so that people will understand what was exactly the problem.
Yeah, so initially I was having like a female kind of voice initially, and it's a high pitch voice basically. And sometimes I used to get a dual voice initially, and yeah, now I think now the voice is stable actually now. So now,
So
yeah,
when you called to the first time after the therapy, the voice to the friends, what was the reaction? Was he able to recognize, or he wanted something reference and evidence? It's you.
actually. So initially, they like I mean, one of my friends initially when he called, they were I mean, he was confused basically. So he was like because he's getting the call from my number, but the voice was different. So he was a bit confused initially, and then he was like, "Okay, what happened to your voice?" And due to this corona again, they started asking, "What happened to corona?" Or have you drunk? And yeah, are you using any voice app or something? So many questions actually, came. So it was like again.
So interesting. So just for awareness, I'm telling at our center, apart from giving voice therapy for the people having a feminine kind of voice or high pitch voice, we also provide the speech therapy, voice therapy for the people having the communication disorder like hoarse and breathy voice due to the vocal cord paralysis and the pitch and the loudness issue. We also provide the speech therapy for the people having a stammering, stuttering. In Hindi we call it the haklana, and suddenly voice has gone, suppose due to some psychological reason. We call it the functional aphonia. There also we have quite impressive result at our center. So those who are watching, I will suggest to them, they can explore our playlist in YouTube channel. There will be playlist options. So if they will explore the playlist, they can find out what kind of work we do at our center and pre and post videos. They will get an idea also. And most important thing is, if you have any communication problem, first explore our YouTube channel. You'll find thousands of videos, not hundreds, thousands of video. And if you'll watch pre and post video, and you will get hope. And once you get hope, that is the first thing. And then if you take professional help, of course it will help you. And we are treating voice disorder from the year 2010. So we have started the online voice therapy in the year 2013. So I think most probably maybe the first means oldest in the world. I can say that one of the oldest. I'm not sure, maybe some other people also. So in 2013 we have started the online therapy, and so we have almost 7 years of experience for the treating online voice disorder. So earlier I was giving only for the international patient online therapy, but because of the COVID, I have started giving online therapy to the Indian patient as well. So, so yeah. So this is a small information about my clinic, but people can click our website. Those who are watching this live, you can click our website www.speechtherapyindia.in, and you will get lots of information about our center, about me, and about work. There also you'll find the videos pre and post. So that also you can click and we'll get an idea. So thank you, Binod, so much, and to being alive. So anyway, it's just you'll get more comfortable to facing the world. So I'm just knowingly I'm extending this live. Okay, so it's a kind of, because you are facing the world first time. Maybe you have spoken to your friends or relatives and all, but now we are live. So if in this situation you are getting a very good voice and all, so it will help you to get more and more confidence with this new voice. Because sometimes what happens, you are using this voice from so many years and we have changed in just few days, so people will find a little bit consciousness, this discomfort, or you can say that they will scared. So this life increases the confidence, so that's why I do. And apart from that, to create awareness in the whole world, this kind of treatment is possible. So those who are having, they should not get frustrated, and they should try to get the professional help from the people like a speech language pathologist, speech therapist. But of course, not from the healthcare quacks. They may damage your vocal cords. Vinod, you can tell one story again. I don't mind any new story. And you watched recently one movie, no? Can you summarize that movie story?
Yeah, sure, doctor. I think it was the movie was about a middle class guy who wanted to buy an airline company. So the initial days he'll be like struggling like anything, like he'll be struggling for like food, and he'll be working for he'll be into the Air Force, and he'll be having a passion that he need to buy airlines. So yeah, he'll put a lot of effort. I think it will be like some 7 to 8 years of effort he will put. And finally, I think after so many struggles, so many politics will be there. Like so many business people in India, they will try to push him down. And finally, after so many struggles, he'll be like starting the airline company. And after starting the airline company, also he will get so much of like pressure from the other airline owners, like top airline owners. Finally, how he's succeeding is the story. So finally, he'll be succeeding. Like,
Okay, so who is the actor in that movie and who is the actress? Who are the co-actors? Do you remember?
the actor is Surya. He's a famous actor in Tamil Nadu. And I don't know about the heroine. I think she's a new heroine. So I think Surya is the major actor. I mean, he's the hero for that movie.
Okay, interesting.
Yes,
So, if you have any plan to watch any new movie in the weekend?
yeah, mostly most. I think so many movies are releasing for this Diwali. So yeah, I think mostly I'll see if I can watch any movies. In Hotstar, I think one more movie is going to release today, I think, in Hotstar. So mostly I'll watch that.
Okay.
And happy Diwali to everyone.
Yeah, thank you. Happy Diwali to everyone. And now I think we can stop this live. And many people have joined. I want to say thank you, everyone. Naif Adnan, thank you so much for joining. And Jaggu Patel, thank you so much for joining. And Suraj Singh, thank you so much for joining. Sahil Singh, thank you so much for joining us. For any queries, feel free to call us at 08042041980. You can get about our services and what kind of service we are giving, and And after perceptual evaluation, we will be able to guide you. And we are giving online therapy for the limited communication disorder, so not for the all communication disorder. And that will be giving the feedback after the perceptual evaluation and sometime after seeing the laryngoscopy report. Thank you, Suraj. Happy Diwali to you. Happy Diwali to everybody. And thank you so much, everybody, for joining us. And thank you, Jagu, for asking the questions about the stammering. And in the stammering speech therapy, of course, help. And we have seen 80%, among 80% people, the significant change after the speech therapy. So you can call us for the perceptual evaluation first, and we'll guide you after that. Jagu, thank you so much. And yeah, thank you, everybody. And happy Diwali, all of you. Have a nice time. Have a nice time to everyone. And thank you, Vinod. Happy Diwali to you also once again.
Sure, doctor. Yeah. Happy Diwali. Thank you.
Yeah, it was good. So I think you got a